What are some treatment options for patients with scoliosis over the age of 50? When patients think of scoliosis, they think of scoliosis as an adolescent condition. And scoliosis is most often diagnosed in children and adolescents. However, this condition does affect adult patients. In fact, the most common type that affects adults is something called idiopathic scoliosis. And then the second type is something called degenerative scoliosis. Now, even though it's most commonly associated with adolescents, the largest population of patients with scoliosis increases with every age of life, or every decade of life, meaning every decade of life where there is a greater population of patients with scoliosis. So we think adolescent cases is somewhere around this 5% range. But as we move into later stage life, like 40 years of age, we think it's more around 40% of patients or people have scoliosis. And there are studies that actually indicate patients that are in their 60s and 70s that it could be up to 50% of patients actually have some form of scoliosis. Now, idiopathic scoliosis, it's the most common type of scoliosis diagnosed, and the meaning means there's no single causation factor, there's no single known cause and why the patient has scoliosis. The most common diagnosis is something called adolescent idiopathic scoliosis, which is called AIS. This is the most commonly diagnosed between 10 and 18 years old, and it's by far what most patients associate scoliosis with. However, idiopathic scoliosis is also the most common form in the adult form, and it's normally an extension of AIS where it was left undiagnosed and untreated during adolescence. Adult idiopathic scoliosis can sometimes be difficult to detect as it's slowly progressing in the adult stage. And this is a result because the curve progresses slowly as a result of compression, and this compression can lead to symptoms, and sometimes the symptoms may not point somebody to thinking they may have scoliosis. Degenerative scoliosis is also a very common type of scoliosis in the adult form, and this is a result of two main things. It's either adolescent scoliosis that was uncorrected, undealt with, and the spine is deteriorating as a result of the scoliosis or unsymmetrical pressure over time, or something small happened as a young adult that caused small shifting in the spine, and this gets uncorrected, but it leads to an unnatural or a faster natural age-related degeneration of the spine, meaning the discs and the tissues around the spine degenerate faster than the rest of the spine. And this age-related degeneration that's happening faster will cause a scoliosis to occur. This is more common in patients over the age of 40 because it needs time for the spine to degenerate. And it's more common in women around menopause when they're going through their hormonal changes. And this is typically somewhere between 50 and 55 years of age. And the hallmark feature is we see severe spinal degeneration in the area of the scoliosis. It's not just age-related, because if it was only age-related, we would see equal degeneration throughout the entire spinal structures, but we only see it where the scoliosis has most of its curvature. Now, we know the symptoms associated with scoliosis vary drastically between adolescent and adult patients. We know scoliosis is not considered to be a painful problem for adolescent cases because they're growing, and the growing is what's causing their curve to progress. This counteracts all the compressive forces of gravity because they're growing, and the growth causes this curve to progress rapidly. We can see kids with very, very severe curves and have no pain. In fact, the largest curve I've ever seen has been in a child with about 155 degree scoliosis, and they had no pain associated with their curve. So what size the curve is in a child is not necessarily related to the patient having pain. However, the condition becomes painful in the adult form because once the patient stops growing, gravity starts to set in and it starts to compress down the spine over time. And this compression over time causes compression to the muscles, nerves, and tissues around the area, which now can cause pain. This compression is what leads to pain in the adult form. Now, what's interesting enough, it's not related to the size of curve, but related to how much your curve actually progresses in the adult form. So meaning you can have two patients, a patient with an 80-degree curve and a patient with a 30-degree curve. And the 80-degree curve may have progressed to 80 degrees as an adolescent and held their curve at 80 degrees, where the 50-degree curve or 30-degree curve may progress 10 degrees as an adolescent and progress 20 degrees as an adult. That 20 degrees of progression in the adult form will more likely cause pain, where maybe the person with the 80-degree curve may have no pain because they kind of held their curve holding it the same in the adult form, which kind of deferred the compression state. Another way of thinking about it is what you develop in an adolescent is almost kind of like your zero. And when you move into the adult form, whatever you add to it through gravity over compression is where it tends to cause pain. And again, the most common onset of pain is patients over the age of 40, and over 50 is when it tends to really make that swing. Scoliosis is progressive and is in its very nature to worsen over time, especially left untreated, and especially if not treated proactively or properly. Meaning a lot of patients with scoliosis, when they move to the adult form, they start having pain. And when they start having pain, they start seeking out treatments. And these treatments, they tend to treat the symptoms associated with the scoliosis. And what ends up happening is when they're treating the symptoms of scoliosis, their problem or their scoliosis isn't necessarily getting better. And they're just kind of kicking the thing down the road to deal with a more serious problem later on. In adolescence, we know growth and development is the number one reason why curves are progressing. And because of this, the number one goal in adolescent cases is to counteract this progression. But in the adult form, the progression is slow. So the treatment can really focus on trying to counteract the progression. Now, the best way to stop progression in the adult case is actually to reduce the curve, because we know as curves become bigger, they're more likely to progress faster, and as patients age, they're more likely to progress faster. So in the adult form, since they're not rapidly progressing, the curve progressing slowly as a result of gravity, the goal should be not only to stop the curve from progressing, but really to reduce the curve. Because if you can reduce the curve, you can take that curve back in time to where it was earlier in their life, and they probably weren't experiencing that level of pain. In fact, that's what we notice with many adult patients, is that if we can reduce their curve back to where they had it 10, 15, 20 years ago, they notice a tremendous amount of improvement in what they're feeling. So the goal with adult patients isn't, we don't necessarily have to get the curve to zero to make them better. We just have to reduce some, take some off of it. Now, pain management tends to be the most common pressing goal for most adult patients. They want to feel better. But just by dealing with what they're feeling and not dealing with what's causing what they're feeling isn't always the best example. Like, for example, scoliosis bracing in adults is more about reducing and decompressing the spine and also helping their pain than it is about correcting massive rib deformities like we do in adolescent idiopathic scoliosis. So what different types of scoliosis treatments exist for patients that are over the age of 50? First and foremost is what I like to call condition-specific chiropractic care. And this is chiropractic care specifically designed for scoliosis patients. Now, many scoliosis patients go to chiropractors and they get help with their pain, but they necessarily don't get their curve reduced. There is a version or type of chiropractic care that patients can go through to help get specific chiropractic adjustments and specific chiropractic techniques to help the curve actually reduce in size. In addition to chiropractic care, there's a variety of therapies used, such as scoliosis-specific exercises, scoliosis-specific therapy and rehabilitation, and also scoliosis-specific support and stabilization. And this could be a combination of physical therapy techniques, of chiropractic rehabilitation techniques, all thinking in a chiropractic mindset or a corrective mindset or a functional mindset to help improve function and restore or reduce the size of curve. And then lastly, there's also corrective bracing that can be used in the short term to help with pain relief and also provide the spine, the scoliotic spine, with the support and stabilization needed to help hold whatever reductions were achieved. The last thing I'd like to mention is the way scoliosis is actually treated. Most patients who go seek out scoliosis care are normally seeking out a patient or seeking out a doctor who specializes in dealing with patients that have spinal injuries, meaning they hurt their back, they hurt their neck, they hurt something, and they get normally what I like to call injury type of care. And this is where the care is typically considered to be a very low dose over a long time, meaning if you hurt your neck or hurt your back in a car accident, you're going to do a little bit of care over a long time to help rehabilitate the injury that you suffered. However, scoliosis, in the majority of cases, is not progressing because of an injury. It's normally progressing over a long period of time. It's this very long progression. It's very chronic. It's very difficult to reduce. So trying to treat it like an injury with a low-dose, long-duration approach normally leads to very little results. So normally with scoliosis patients, we normally like to invert the model, and we do something called high-dose, short-duration treatment to help get enough energy or intensity to help reduce the curve, and then at that point stabilize the reduction over time. When it comes to treating scoliosis, we always know the sooner the better, meaning the smaller the curve, the better the result, regardless of age. So there is no real benefit in watching and waiting. Most of the time, all you're going to watch is your curve worsen over time, and then your treatment options are going to become less effective, and more likely you're going to have to start considering more invasive treatment options as your curve progresses. Here at Scoliosis Reduction Center, we really work on trying to reduce the size of curve, try to preserve spinal function, and prevent further spinal deterioration to make sure that your body has the best ability to not only age, but you can remain functional over time, so you can age and still function and do the things that you love to do, and you're not impaired by abnormal spinal function. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.